Hey, Dr. Keith, it's Labor Day
Hey,
weekend, but we're here.
yep, we are here and we're ready to talk about bones.
We are. It's Love Your Bones Day. Love your bones.
Yes, it is. It's a beautiful day to talk about Love Your Bones.
It is. It's a beautiful day. I went paddleboarding this morning. I used my bones. I'm so strong from paddleboarding. This is my best part of the year because I can paddleboard every day.
Oh, you can.
Yeah. So I've
You
been
still paddleboard with your little dog?
my dog. Harper loves it. She was
Mm,
out. Yeah, she loves
that's
it.
cool.
But
We need to have a television show about Harper.
I know, I know, we'll do. That's a whole nother web
That's a
series.
whole other.
I think we should do a show about dogs though.
Yeah,
Because I think walking a dog is a great bone thing. I
it,
think everybody should have a dog, and you have to walk your dog. You have to use your bones. You have to do
well, yeah.
exercise.
I mean, and that's interesting you say that because that's the exercise component. In addition to having caring for a creature or caring for someone that cares for you,
Yes,
from the psychological aspect of it.
yes,
But you're right about that because if you didn't have the dog, then no, you would never be forced to go out
exactly. I
and
wouldn't walk,
walk the dog
right?
and
Right
walk
now, I
around.
have to walk 3 times a day. And I think we walk a good, 20 minutes or, longer in the morning. But,
Yeah. So
but
that's the show.
uh, we have so much to talk about this month. Like,
So what month is this?
it's Prostate Cancer Awareness Month.
Yes, it is. And you know, a lot of people don't know that.
Yeah.
And,
And a lot
and
of people don't know that, and we need to know it. It's a cancer, like breast cancer.
cancer.
I call it black prostate cancer, just I call it black breast cancer because it is. It's a thing for us.
And that's important because I think that a lot of people don't hear it. You don't hear it in the media. You don't hear someone to stand up and say, this is the leading cause of cancer in Black men.
Say
Just
that.
like,
Say that
just
again.
like no one says, I'll say it again, this is the leading cause of cancer in Black men. You hear about all the other cancers, but no one can make a definitive statement, or you have never heard anyone make a definitive statement. It's always in accompanying with someone else or
Right.
the second leading cause of cancer for men. But no
Right.
one makes that statement, just like no one makes the statement about triple negative disease and Black women.
Right.
I said, this is an advanced disease. It impacts Black women at its greatest.
Yeah.
But no one comes out and makes a strong statement about this to
Right.
get motivated about screening and early detection. The next thing is this, that the majority of people don't recognize, whether it's prostate cancer or breast, that there's a relationship between the cancer and bone health.
Yes.
And so
Yes.
I did an episode, aired an episode on Fin, which is on Fin TV, a prostate health education network television, that talks about bone health. And I thought it would probably, if you didn't mind, I would like to share that with our
Yeah.
audience.
Let's share it. Let's share it. I think it's a great thing. I'm gonna share it.
Because remember, and this is something that holds true that we say as a message at Fin, and knowledge is your best defense against prostate cancer. But this holds true for breast cancer and all other cancers. And that's why we're here talking about your bone health.
Yeah. When you get metastatic, where does it go first? To your bones, right? Right.
Yeah,
I'm gonna hit play here, right? Here we
yeah.
go.
So the topics this afternoon, first, we'll talk about prostate cancer's link to bone health, some bone basics, bone loss, osteoporosis, bone loss risk factors, diagnosing bone problems, bone loss prevention therapies. So these are some important terms, and I'm just kind of repeating what we've heard throughout the afternoon. We know what a cancer survivor is, and it's a person who has been diagnosed with the cancer, in this case, prostate cancer. Cancer survivorship begins at the time of diagnosis and includes the periods of initial treatment with the intent to cure, cancer-free survival, chronic or intermittent disease, and end-of-life care. One other point we want to bring to your attention is health-related quality of life. Quality of life is so important. So it's defined as is an individual or a group's perceived physical and mental health over time. Health-related quality of life studies show that prostate cancer and its treatment effects, both disease-specific, health-related quality of care, urinary, sexual, bowel, you've heard this in previous discussions, but also general, which would be energy, vitality, performance, and physical and social roles. These effects appear to differ across stages of disease and treatments. But the point is, bone health is one of those topics that are rarely mentioned and that also significantly impacts both disease-specific health-related quality of life and general health-related quality of life. And when we talk about survivorship and the problems associated in survivorship that affect your quality of life, we've heard about coping emotionally, sex after prostate cancer, erectile dysfunction. What diet should I have after prostate cancer? Managing the side effects of prostate cancer, urinary dysfunction, bowel dysfunction, infertility. So, does prostate cancer impact health, bone health? And the answer is yes. There's a link between prostate cancer and osteoporosis. Osteoporosis is bone health. Most men diagnosed with prostate cancer are age 50 and older. As men get older, their risk of osteoporosis also increases. Prostate cancer is a major risk factor for bone loss and fractures. The invasion of the bone by cancer cells causes bone loss. In addition to the cancer impacting the bone directly, prostate cancer treatment can contribute to bone loss also. Male hormones such as testosterone, which is an androgen, protect against bone loss. And when blocked, the bone becomes less dense and breaks easy. Studies show that men who have received androgen deprivation therapies, ADT, for prostate cancer have an increased risk of developing osteoporosis and breaking bones. Lupron and Digorex are examples of ADTs that induce bone loss. So we have an understanding about the impact of prostate cancer directly and indirectly on the bone and bone loss. So how is prostate cancer induced? How is prostate cancer bone loss detected? Prostate cancer more commonly travels to the bones first, and that's a very important point. Bone scans can detect whether prostate cancer has spread to your bones. Presently, bone scans are only suggested for intermediate unfavorable risk in the more advanced stages of prostate cancer, metastatic disease. Patients with low-risk disease do not regularly receive a bone scan. So we clearly have a relationship between prostate cancer, its treatment, and bone loss. But let me back up a little bit. Let's talk about the basics of bone health. Now, the majority of us know that bones play a very important role because our muscles attach to the bone. We also know that bones protect our heart, our lungs, and some big vessels inside our chest. But did you know that bones store minerals, or bones produce your red blood cells? If we look at it at a microscopic level, it's important to recognize, and a lot of people don't recognize, your bones are alive and they're healthy. And it's a simple tissue. It's composed of 3 cell types. One, and you have to forgive me for the cartoons, is called an osteoblast, which plays a role in building up the bone. So Bob gives you an example. Osteoblast, because it has the letter B, I use Bob as that example. Osteoclast, and focusing on the letter C, cuts down bone. There's a balance that we look at. Building bone up, osteoblast, Bob, or cutting bone down, osteoclast, Claude. And the last cell, it secretes bone around the blood vessels. This is important. And the way to think about that cell is think about a brick house that has layers of brick, and you have the mortar in between, and the mortar helps keep the bricks stable and in place. And that's what the osteoclast secretes. What is osteoporosis? Because we talk about bone loss. Osteoporosis, what really is it? Osteoporosis is a condition in which bones become weak, less dense, and more likely to break. Now, this is very interesting here. Most people, and even some doctors, think osteoporosis is a woman's disease, but millions of men develop it too. Men who break bones are less likely than women to be treated for bone disease, even though treatment can help prevent broken bones in the future. Let me give you some examples of what causes bone loss. Various diseases, medical conditions, and medical procedures can play a role in bone loss. Now, you heard me earlier talk about prostate cancer and bone loss, but ladies and gentlemen, breast cancer also plays a role in bone loss. Now, this is something that's novel that you won't hear, or you'll begin to hear more of. COVID-19 infections also play a role in bone loss. Now, primarily it was from steroid injections, which affects bone loss. But also there are more and more reports that are being published that suggest that the virus itself causes damage and causes bone loss. Now, some other areas like digestive or gastrointestinal, GI tract disorders, celiac disease, inflammatory bowel, endocrine or hormonal disorders like diabetes, hematological or blood disorders like multiple myeloma, sickle cell disease, surgical procedures, neurological problems like stroke or spinal cord injuries, mental health, radiation, and chronic kidney disease. What can be done to decrease or reverse bone loss? Kind of keep everything simple. We can group that into 3 categories. First, nutrition, regular exercise, and a healthy lifestyle. Now, from a nutritional standpoint, a well-balanced diet, rich in calcium and vitamin D is important. Men between ages 19 and 70 should have 1,000 milligrams of calcium per day. Men over the age of 70 should have a little bit more, 1,200 milligrams a day. Now, it is suggested that vitamin D ingestion per day is about 600 to 800, but we have to recognize people who have a darker complexion may require more vitamin D. And the large percentage of Black America and other groups who have darker complexions, and even people that live in the North, are vitamin D deficient. So I would suggest you talk to your doctor and have your vitamin D levels tested. Regular exercise. And what I said before, bones are living tissue that respond to exercise. So weight-bearing exercises are important. Walking, climbing stairs. I like line dancing. So dancing is something that you can do. Resistance exercises, weightlifting. Lastly, if we move to lifestyle, smoking decreases calcium uptake from foods. Drinking alcohol. Heavy drinking weakens your bones and increases your risk of broken bones. Moderate drinking is suggested. For men, 2 drinks a day. For women, about 1.5 drinks a day. I don't know how you can get 1.5, but that's what's suggested. Your sources of calcium are going to be very important too. This goes back to your diet. You can use tofu, soy milk, green leafy vegetables like broccoli, Brussels sprouts, mustard greens, kale, Chinese cabbage, bok choy, beans, tortillas, sardines, salmon, shrimp, fortified drinks like your orange juices, fortified breads like your pizza and bread. Also nuts and almonds, dairy products like milk, cheese, and yogurt. Now, we have an idea of how to reduce it. Let's talk about how do you diagnose these bones issues. The most common methods of diagnosing bone issues: the bone scan, X-ray, CT scan, MRI, and the bone biopsy. But we're going to focus on the most common that looks at bone density. This is a bone density scan. Another term that you may hear is the DEXA scan. And when we look at a bone mineral density scan, is the best way to determine your bone's health. BMD tests or DEXA tests can identify osteoporosis, determine the risk of fractures and broken bones, and measure your response to osteoporosis treatment. Now, this test is painless. It's like having an X-ray, but with less exposure of radiation. So these pictures here, on the left, you'll have a thick appearance. And if you look to your right, this representing osteoporosis is much a thinner appearance of your bone if you're looking at it, looking inside your bone. Now, the DEXA scan, the bone scan, gives you a T-score. The T-score compares your bone density to that of a healthy adult. The T-score of 0 shows what bone looks like without osteoporosis. So here's our T-score. I'm at the image, the bottom left, you'll see T-score 0.0. And if you go up, this thickness you get to see is just healthy bone, normal bone, without osteoporosis. Now, osteopenia is kind of weakening of the bone. If you have a score between less than 1 and 2.5, less than 1 to 2.5, this area here is representing osteopenia. Osteoporosis, on the other hand, is a score less than 2.5 here, moving in this direction. So you get a better image of what an osteoporotic tissue looks like. Important to know, for every 1 decrease in your T-score, your fracture risk doubles. Regardless of your BMD, bone mineral density, after the first fracture, you are 5 times more likely to experience another. What are some bone loss preventions therapies? And we go back to our boys, Bob and Claude, and just to kind of give you an example, but zoledronic acid, well, it's another name would be, you may have heard of recast or zometa. These are bisphosphonates, and they inhibit the digestion of the bone by Claude here because they kill the cell. So in this case, they kill Claude. Now, other therapies are denosumab, which is an anti-bone loss agent, but this is different. This is an immunotherapy. So it doesn't kill the cell. It basically interferes with the receptor and slides between the cell and the bone, so you can't really break, the cell can't break down the bone anymore. This is very important because you have to talk with your clinician in this shared decision-making process to determine what is the best bone treatment for you. And this is what you need to know about the right bone treatment. First, renal failure can be associated with some androgen deprivation therapies. Some bisphosphate drugs can lead to kidney failure, zoledronic acid. Denosumab, Xgeva, is listed as the preferred NCCN treatment versus zoledronic acid because it's more effective at delaying bone problems. And remember, the denosumab has a lower risk of causing renal failure. Important bone health takeaways from my talk. Men can develop osteoporosis, especially after the diagnosis of prostate cancer and receiving androgen deprivation treatment. Once diagnosed with prostate cancer, you need to discuss with your doctor about monitoring your bone health. You need to know your bone score. It found an increased risk, fracture risk, for bone fractures. Talk with your doctor about which anti-bone loss therapy is best for you. African-American men and those men who are at greatest risk for renal failure should review the best treatment options available with their doctor. Denosumab is the preferred treatment for men with metastatic prostate cancer disease. So, when we talk about bone health, knowledge is your best defense against fractures. So Ricky, we can stop here, or there is an episode.
All right. Thank you. Thank you very much, Dr. Crawford. Quick question. How often,
You there?
Yeah.
That was great, but I have so many questions for you.
Okay, all right. People were listening.
I know. I have so many questions. So first of all, the meds that men are taking for prostate cancer are causing bone loss.
Yeah.
Is that true for breast cancer too? I never heard that before.
Yes, it is. Because look at the principle that you'll hear from your doctor. As your testosterone, as your estrogen level starts to decline, and testosterone for men with age, right? We know that that's the case. And we know that after you reach the age 30, your estrogen level starts to decline.
It's the same kind of hormonal impact for men as it is for women. Get it? Okay. So yeah, when your estrogen goes down, your bones, you have bone loss. Get
right.
that?
Now, guess what happens? That the primary target for prostate cancer therapy is testosterone to either prevent its interaction or prevent its production. In doing so, you begin to weaken bones. But remember, you don't hear that relationship. You're hearing that relationship here on our show, but you don't hear people talking about it.
Right.
Because you know why that's the case? At one time, doctors were focused on just keeping you alive for a couple of months when you had cancer. Now we're at a point where researchers and pharmaceutical companies and healthcare providers are having treatment options that are extending our life. Case in point, your anniversary is coming up.
Yeah, it is.
How many years are you?
12 years on September 21st. My Earth, Wind, and Fire song.
12 years.
12 years, 12 years.
So
but yeah, I get it because if you have ER positive breast cancer, estrogen or hormonal breast cancer, the drugs that we're taking are stopping the hormones. And those are the drugs that you take for like 5 years. So, triple negative, we don't have that. So, our breast cancer isn't fed by hormones, but I can see where the bone thing happens with breast cancer too, with the loss of with the hormonal kind of stopping the hormones from raging.
Even when you start talking about your diet changes, depression, diet, all of that plays a role, in addition to the fact that as you get older, that your estrogen levels are going to decline, especially when you're in a premenopausal state. And the other point too is with most African Americans and most Black folks, we're lactose intolerant. So we're not even getting enough calcium. We're not outside.
I eat the ice cream and the cheese and the stuff that I eat every day.
And we're not getting enough sun. We're not out there going with you and your dog.
I know. I'm Black now too. It's summer, end of summer. Well, all right. So that's one of my questions. So the next one too, you talked about bone scans and how I know women aren't getting bone scans. We hear it every day. So the same thing for men. And even when you have metastatic prostate cancer, they're still not getting scans.
No.
What's up with that?
So it's just that like I said before, it's not a part of the workflow. It's becoming more and more of an issue. But you're not hearing men learn about bone health when they start taking anti-androgen therapies. They're not hearing about it. They hear about it from me because the first thing I'm going to ask is, are you taking calcium? Are you taking your vitamin D? Have you had a bone scan? And the first thing somebody says is bone scan. What I need a bone scan.
Break down the anti-androgen therapy, the ADT thing. Can you just explain that one more time for the 5-year-olds like me?
Okay. So what you do, so in prostate cancer, testosterone plays a major role at causing the cancer to grow.
So
So
same
what,
thing like with estrogen and breast.
right.
Yeah.
So what they learned earlier on is, and this was a treatment, they used to remove the testicles of men as a form of cancer treatment. And by and that's the term castration. So you had the physical castration, and now they made identified drugs that cause a, guess what? A chemical castration. So you're
Okay.
not removing
You
it,
have to cut them
but
off.
you're cutting you. So if you cut it off, you're removing the source of testosterone.
That sounds so horrible.
So that's why we transition to chemical castration, where you're using chemicals to decrease the concentration of testosterone. And that's just the basics. So now the cancer grows. And so now what we're able to do is in our therapies, we either interfere with the overall production of testosterone, or we interfere with testosterone's interaction with the cancer. And that's kind of what takes place in breast cancer when there's a hormonal impact.
Mhm. Okay. Ooh.
When estrogen has an impact on the cancer. But remember also, you need these androgens, these testosterones and estrogens to keep your bones healthy. So if
Yeah.
you interfere with it or you stop it, then you interfere with it.
You bear with it. Wow. Wow.
Okay?
All right. So also in the video, you said that that more men are getting osteoporosis than women, or something about difference between men and women.
Well, more and more men are getting it because one, we're getting older. So there's a focal point. There's clearly a focal point where you'll start to see with age, there's a dramatic increase in the number of men that start developing osteoporosis as they get older. So when they reach that 65, 70-year-old time frame, then the numbers increase dramatically. And that goes back to lack of exercise. I see, look at the fundamentals. It's your diet,
Your exercise.
and are you being supplemented? Are you taking your vitamin D? Are you taking your calcium? And then the other thing too is you throw in some other things like smoking, drinking.
Mm-hmm.
How much are you drinking? And people still drinking. We're not saying you can't drink, but several beers a day versus a beer a day.
Mm-hmm.
And also, we're learning more and more about this. Do you have a family history?
Mm-hmm.
There's stereotypes that exist.
Our Black families are just not talking about it, and we got to talk about it.
But we're not talking about it, but our healthcare providers need to be talking to us about it.
Mm-hmm.
Because remember, as a clinician, and there was a Rudyard Kipling, and there
Yeah.
we as a healthcare provider, you need to be able to walk with kings, but you got to be able to talk with the regular folk.
Mm-hmm.
And that's what's part of it. And like I said before, a major problem is at one time it was you have cancer and the doctor or healthcare provider is telling you need to get your affairs in order.
Yeah, right. They write you off. Right.
So everybody's leaving once they hear I got cancer. So it looks like I got 6 months to live. Versus, wait a second, if I do these therapies, I have these new next generation therapies, and I could participate in a clinical trial. I mean, 12 years out.
Well, that's why I'm here. That's why I'm here. My doctor told me I had to.
Mm-hmm.
And I'll be 12 on September 21st, but I had to take some experimental drugs.
Right.
That's what saved my life,
Right.
And I had to fight for myself to get them. I had to go find them for myself back then,
Right.
And so now we're trying to make them available to people.
And I wanted to highlight that. It's so important that experimental drugs are not just experimental drugs to fight cancer. There's experimental drugs that help build your bones.
Yeah, for all therapies, all drugs. Yeah. And so we know some great bone therapy trials.
Yes.
So we have some great stuff on that. If anyone wants to know about it, just email us. But all right, here's my next question. You ready for this one?
Okay.
You talked about COVID. So if you have had COVID, should you get a bone scan?
Well, what I'm saying is, let's take it a step further. If you have not had a bone scan and you're supposed to get a bone scan, you need to get a bone scan.
Okay, regardless of.
Regardless of COVID.
And how old is that for men and women? Same age, 50?
No, I think I go back with ethnic family history.
Okay,
Okay. And for Black people, I'm pushing towards 40.
40, okay.
There you
Well,
go.
you know I'm all about.
But
you
you
know,
already know,
Yeah.
you already know that the estrogen levels and are beginning to decline at 30. You already know that. But you have, and this is why I'd like to stratify, because they say like, well, the incidence of osteoporosis is higher in white women.
Mhm.
But the issue of osteoporosis, if you take away race, because you're doing a disservice, if you look at the body type of the individual,
Mhm.
because you have Black women who are thin framed,
Mhm.
or small boned, who are lactose intolerant, who have lupus or suffer from autoimmune disease, who were treated with steroids.
Mhm.
So everybody tries to lump everybody together, and they can't do it. They have to look at that history. Every person is unique and an individual. We're bringing it up to them and saying, be on the alert to talk to your doctor about your healthy bones, about bone health. Because once you get a fracture, the chances of getting another fracture increase.
Mhm. And we do not want that, happened to my mama. Happened to mama. Can you talk a little bit about osteopenia? So if that, so osteopenia is kind of early stage osteoporosis, right? Can you stop it if you take drugs and stuff and do the right thing? And stuff?
It's very interesting is that at one time, osteoporosis was something that you wanted to slow up the progression of the disease. But if you remember our last episode,
Mhm.
one person, there's new therapies out that help rebuild the bone.
Yeah, Christina stopped it. That's right.
That's
And
exactly
she
right.
totally reversed it.
Right. So that means that there are therapies out there
Mm.
that can help
Right.
you reverse it. Okay. But you have to do what you need to do. And
Right.
then you need to do your work too.
Right. And she did. She took the meds. She did the exercise, and she did the diet.
diet.
She's a poster child.
So
Yeah.
you have to, it's just not a miracle therapy.
Mhm.
There's some lifting on your side, things that you have to do to make sure you protect and love your bones.
Mm.
Yeah.
Woo. Okay. All right.
Just think about that. I said, like, yeah, because she
She did
stated
all the things.
that her bones were better. Her
Yeah.
bone density was better. And that was extremely exciting for this field of bone health and osteoporosis or bone loss prevention.
Mhm. Wow. Wow, wow, wow. Well,
And
okay, that was awesome video. Everybody should watch it. And also, so they can find it and a bunch of your other stuff too on FEN TV, PHENTV.org.
is it .com?
.com. So PHENTV.com. And there's so much great content. The PHEN stands for Prostate Health Education Network. That's, keeps baby.
And then
And
interesting that you say that, Ricky. There are a lot of people that don't, people don't even think about their bones.
we take them for granted. We get up
Right.
in the morning, you sit up in the bed, and you get up and you walk.
Right. And what do? I mean, they basically provide structure and form to your body.
Well, you don't appreciate them until you lose it. Like I look at my mom, who's 90, who never doesn't have the mobility anymore. And it's so frustrating to her to not have that ability to stand up on her own and walk across the room. Think about when you lose that. And I mean, she lost it. I mean, she went a lot of years. She's 90 without, having it, but I don't ever want to lose it. I figure if I stop paddleboarding, I don't want to be here.
Oh, we just have to keep you paddleboarding.
Yeah. You have to put me on that thing.
Matter of fact, we might have to do a podcast from the beach. So where do you paddleboard?
I live on the Chesapeake Bay. I live on the marina, so I literally walk about 50 feet, put my board in the water and go out into the bay. And I'm out there usually by myself, early in the morning, and a couple of fishing boats are out there, and my neighbors take pictures of me and Harper. But I know, but when I got breast cancer, when I got better, I moved to the beach. I sold my big house. I moved to a little condo on the beach because I wanted to be, my peace is non-negotiable. And I wanted to be able to, be in nature,
So I was looking at it.
I
think about everything that you do to make your bones healthy. So the fact that you're out rowing and standing up, so that strengthens your bones.
Yeah.
We're out there in the sun.
I'm getting my vitamin D. Yeah.
Vitamin D, because
like I am.
So you get your vitamin D.
I do wear sunscreen, so the black is coming, but.
And then, and so a lot of people don't know. It's like you anchor, bones anchor your muscles.
Yeah.
And they help store calcium. So you think about it's like a little bank, your retirement.
Mm-hmm.
And so that's a way to look at the bone health as more of your, you have a store of calcium.
Mm-hmm.
And you have to replenish it. If you don't replenish it,
mm-hmm.
you don't.
Harper heard me talking about paddleboarding, so she.
Oh, okay. So that's her scarf.
No, that's her collar, but she.
I thought it was
she wears her little life jacket.
Oh, okay.
She wears her little life jacket, but she goes out there with me too. So she has strong bones too, don't you, Harper?
Yes, but so Harper, fur matches the touch color thing.
Yes, she matches our color scheme, right? I've got Uz's dog here too today, so she's crying in the background looking for her mama. I'm at Dog City here, but wow, I think this was a great show. I think we talked about a lot of stuff. I think that oh look, this is Zane.
See that? So
talking to
Harper's on TV. Harper's on TV. How come I can't get on TV?
I know, right. Zane's like, I'm coming on TV too. But no, I think we I think your stuff is a good reference point. But before we close out, let's talk about the stats on prostate cancer.
Yes.
Let's talk about the incidence for Black men. So whereas breast cancer, we have the same and really a little bit less incidence of it, like less Black women are getting it, but we're dying at a 41% higher rate. What are the prostate numbers? Let's talk about for September.
Well, it's very interesting that you say that I was the numbers are very interesting. I was going to pull up, I thought I could pull it up. There's something, see if you want to go over some stuff, some numbers. The first thing I wanted to say is this. If we look at prostate, breast, lung, and bronchus, and colorectal, these diseases are increasing.
The Black ones.
But they're increasing.
Mm-hmm.
But what's startling is this. The American Cancer Society estimated between 2019 and 2023 that the incidence of prostate cancer would increase by 65%.
Because of COVID, or why?
That's not even COVID.
Really?
That was, yes. What's happening is that there was a point in time where the incidence of prostate cancer and prostate cancer death dropped dramatically. Then all of a sudden, there was a concern about overdiagnosis and screening. And so around 2012, they stopped screening because there was a change in
the PSA test.
And then all of a sudden, then the incidence starts to increase.
Oh.
And so even the American Cancer Society came out and they're really pushing the importance of prostate cancer awareness and the impact on Black men. And you'll see a lot of groups out there now trying to educate Black men. But Finn's been here since, matter of fact, this is Finn's 20th anniversary. We have our summit this is the 19th annual summit. So the month of September, we know, is Prostate Cancer Awareness Month, and we know that we host a month. Each Wednesday of the month, we hold a session that talks about key issues in prostate cancer. We bring in political leaders, religious leaders, and talk and clinicians, healthcare providers, and patients to talk about these problems that we try to address. So
what time and where on Wednesdays? We'll put it in the comments, but
it's Fin Summit, so you can register at finsummit.org, and it's Wednesday Eastern Standard Time between 1 o'clock and 3:30.
okay, I'm hoping it wasn't during the doctor is in on Wednesdays. Good. So it's at 1 o'clock Eastern time, 1 o'clock Eastern time. And then what? PHENsummit.org.
And matter of fact, we'll be working with Black doctors during that period of time. So we'll air it live because we're inviting people in, and we're approaching the maximum capacity for viewership. And so we're working with Black doctors to make sure that we can air it
Get out there to the world on
everyone during this period of time.
Black doctor, love them.
But to go back to your numbers again, we know that this is alarming. It's alarming because this is not including COVID. Now, what's important to recognize is screening saves lives.
We know that for everything. You got to catch it early. You got to catch it early.
And we also know that if you detect prostate cancer early, that's when it's localized in the prostate, the 5-year survival is 100%. What do you think the 10-year survival is? Close to
100%.
Yeah, it's like 98%.
So if you catch it early, you're cured. The same with breast cancer. You know, we say that if you catch breast cancer under stage 2, it's curable.
Yeah, and so that's that whole
screening. It's all about getting that screening. So how
if you
PSA? When should Black men get a PSA? If you have a family history, which you probably do, you may not know about it because you're not talking about it. So just assume you have one. Right?
Okay. If you have one or don't have one, we suggest, and the National Comprehensive Cancer Network, these are the people that provide the guidelines for cancer treatment, especially in the prostate breast. Each one of them have their own little group, but they provide it. Age 40, the American Urological Society states age 40.
Okay.
So, right. And if you're high risk, and if you're a person with African ancestry, and what about this BRCA?
Oh, no, I know. That was news to me when I pulled the data the other day. Yeah, BRCA is the thing, man. And so if your mom has breast cancer, you're at risk for prostate.
Yeah, see, that's what people don't understand.
And vice versa. If your dad has prostate, you're at risk for breast cancer because you
and you have has prostate and he's BRCA positive.
Right. And BRCA2 is more prevalent, has more cancer, right?
There's a greater association with it. So I won't go into the details because we don't have enough information about Black people.
I know what
the majority of genetic information out there is based upon people of European ancestry. This is not a dig. It's just that there's not a lot of information out there. Now,
breast cancer, it's the same with breast cancer. The more we need more science, we need more data, we need more people to participate in trials. And Dr. Keith, we're up to now 12,000 Black women in clinical trial portals.
But that's why that's important.
Yeah.
Because, why is that? Why have you been successful about educating Black women, getting them to the portals, getting them to look for clinical trials? Why? Because you are a trusted resource.
It's a breasty thing, you know, I mean, and I don't know if prostate, because Black men don't talk as much about it, but you know, we have this breasty club where, you know, we trust each other, we love each other, we want to help each other. So we talk about
We're,
and
we're kind of let me see, but that's it. But that's the dynamics.
and Black men too, but that's why Black women have to talk to their men. You know, come on, women. You know, well, you know, the Black women are the CEOs of the family health.
And the CEOs or the CMOs,
Yeah.
medical officer. I said, like, look, hey, but what you're saying is so important. There's
Yeah.
two people out there. They're the wives. And when we do a lot of even when we toured the nation with our Daddy's Boys stage play,
Yeah.
we have 60% wives, mothers, daughters participation, and 40% men talking about prostate.
About prostate. Wow.
And
And
so
what is the number? Black men, I put in our e-blast, it's 64% more likely to get it, but you said it's 74, 75, right? We don't really know. It could be.
And see, that's very important because you see how it's not to correct you, but let's just step back a little bit. And what do we talk about? If I ask you the question, what ethnic groups has a high incidence of triple negative disease? Who would that be?
Women, 3 times the rate of white women, Black women.
You see how when people ask the question or they convey information,
Right.
it depends on what question you're asking.
Right.
So if you look across the United States, in each state, in each city, in each region, the incidence of prostate cancer is different.
Yeah, sure. And that's the same with breast cancer, but we know.
So you see what I'm saying? So now
Yeah.
you have to be careful because when people
Right.
make that statement, it's like, whoa, well,
Right.
you know, you're incorporating a whole bunch of other states.
Right.
But the point is, it varies and it is higher. And what's interesting is this: it is not only is the incidence higher in Black men, but if you break it down and you look at local disease compared to distance disease.
Yeah. And distant meaning metastatic, meaning stage.
Yeah. And the number of Black men that are developing or diagnosed with advanced disease is twice that of white. That's just the diagnosis, the incidence.
And then what's the mortality?
The
mortality is double the rate for Black.
Double the weight for about 2.2 higher. But also you have to take into consideration that people don't incorporate other ethnic groups. So the death rate is 2.2 times higher, up to 4 times higher, depending on what ethnic group you're talking about.
All right, so tell me, break that down for me. Like now Bella's 6, so I have to say 6-year-olds.
Right.
So for
if you were
comparing, white men die of prostate cancer, how many Black men die?
It's 2.2 times greater rate.
So for every 100 white men who die of prostate cancer, that means 220 Black men die.
Yeah,
Do you think that?
That's
For every 100 white men who die of prostate cancer.
For 100,000. So when they
Oh my God.
they look at the rate of death. And then if you compare Native American, Native Alaskan, that's another group, Asian, that's another group, then the disease itself does not impact them at the same rate as it impacts Black men. We're not saying that they should not be made aware of it, because all Finn's tools are not just for Black men, it's for all men. We just bring attention to the fact that there's a disparity that exists when it comes to Black men with prostate cancer, the screening, diagnosis, care, treatment options, and participating in clinical trials.
All right. We got to go. We got a lot more to talk about prostate. So we'll do another show. We'll do a Dr. Zen episode about prostate, but everybody. So the resources for today are phentv.com, phentv.com. You know, and if you need anything, you can always reach out to me, Ricky at RICKI@touchbbca.org. You can reach out to Dr. Keith.
Yeah. And I want the audience that we have to recognize is this. and I'm sorry if I throw you out there, Ricky, but Ricky and I are on call.
Yeah, we are always 24/7.
24/7, because if we're not out there
Hotline.
doing
Right,
it,
right.
if we're not out there doing it, who's going to do it?
Who's gonna do it? Who's gonna do it? So reach out to us, and if you can't find Dr. Keith, I can find him. So
Definitely. That's right. We'll get it done.
we'll get it done. Especially if you're looking for a trial, we got you.
Mhm. We're surveying. Ricky and I look and identify those clinical trials that are actively recruiting.
Yeah, we got you. We're doing.
You find something out there and you have a question about it, we'll get you back in. And we want, this is something else. We want folks to participate, because more and more of the clinical trials are providing resources to help you travel.
Yes, to travel and take care of you and give you creature comforts and gift cards and food cards and gas cards and everything. And now, you know, we actually have Val, our co-founder. She's now our chief nurse navigator, breasty on duty. Our nurse navigator program. We have our hotline where people can call her and get care during the trial.
Right.
All right. So we'll see you next month.
Next month.
And next month is my month, our month, breast month.
I'll be passing that baton on.
All right. And
have
meantime,
to
I'm gonna
figure
have
out
a party for my life-versary, and everybody, you know, get your bone scan, get your DEXA scan, ask your doctor for it.
And talk to your family.
Talk to your family.
Take
Talk
the time to listen to your family.
Yeah, yeah. Go take a grandma out to dinner, out to lunch.
Get some of that history.
And get some collard greens in the meantime.
Oh yeah, that's true. That some collard greens, some kale.
Yeah.
But you know, I'm still waiting for my peach cobbler.
I know we got peaches. I got you. All right, I love you, Dr. Keith.
All right.
You.
Love you. Everyone have a nice rest holiday weekend.
Yeah. Enjoy your holiday.
Bye.